Hello everyone, my name is Ariel Favela and this is my presentation on my comparative analysis of the Philippine healthcare system. To begin, I want to give a little bit of background information on the Philippines. The Philippines is an archipelago nation that consists of over 7,000 islands located in Southeast Asia and the Pacific Ocean. This country is located just north of the equator, which grants it with tropical weather all year round. And uniquely for the Philippines, just in its geographic location, this nation is very prone to natural disasters, specifically like typhoons, tsunamis, earthquakes, and even volcano eruptions. The government of the Philippines is a democratic republic that is very similar to the setup of the United States, and the capital city is Manila. To fully understand a healthcare system, we have to start by looking at the people that they actually serve. So to start, we will look at the demographic information of the Philippines compared to that of the United States. The population in the Philippines is over 113 million people, while in the US it is over 336 million people. Male to female proportions are pretty similar, with them being pretty close to 50% on each side. The difference we start to see mainly is when we get to age segmentation. For both countries, most of the populace is still within the groups of 15 to 64. However, in the Philippines, we see that in the ages of 0 to 14, it is about 30%, versus in the US, where we see a higher group is in the population over the age of 65. This is important because when we see changes in age segmentation, it usually shifts medical services, which right now in the Philippines, most of them are geared towards children and middle to young adults, versus in the US, a lot of the attention is placed on senior citizens or populations over the age of 65. Both populations in the Philippines and the US consist of diverse populations, including different populations of immigrations. The difference that we also see is in the HDI, the UN evaluation system, where we see that the United States by far is considered a developed country with 0.921 rating, and the Philippines is at 0.699, which still leaves it as a developing country, even though this will be changing soon, as the Philippines economy is one of the fastest growing economies currently in the region of Southeast Asia. When looking at the actual structure of the healthcare system in both countries, it is important that we talk about the Philippines' history. After being ruled from Spanish rule in the 1900s, the Philippines became a United States territory until the Philippines became fully independent. So, the Philippines, from the government structure down to the healthcare system, is very similar to United States care, with variations that came later in time. So both systems are pretty much decentralized systems that rely on giving power to local or regional authorities. Both both countries have a public and a private sector, with the Philippines being split pretty much down the middle, but the US is mostly a private sector with limited public. The healthcare delivery in the Philippines is mainly done through the public sector, that then is supported or substituted through the private sector if people can pay for it. In the United States, it is mainly hospital-based, with an increase now towards community-based. Both are composed of physicians and other clinical specialists that deliver these services to the people in the area. Where we start to see big differences is when it comes to financing of healthcare services. In the Philippines, currently there is universal healthcare that is called PhilHealth that is provided to all Filipinos. There is also private insurance that can be used as an addition to or substituting to PhilHealth, and there is also the option to self-pay. In the United States, it is mostly come down to private insurance, with there being public aid for just select population groups. For Medicaid, we see that that can be done for young people or children, and can also be given to low or middle class families, when we also see Medicare, that is a public aid grant that is given to people over the age of 65. But most people have to rely on private insurance or either self-pay in the United States to cover their healthcare needs. So to see if a healthcare system is actually benefiting and helping the people it is serving, we look at specific statistics or health outcomes among the population. Starting with life expectancy, in the Philippines, we have seen a rise on life expectancy over the past few decades, with the current one being at 72.1 years, while in the US it is currently at 77.2. Infant mortality in the Philippines has also continually gone down over the past decades, with it currently being at 17.5 deaths per 1,000 compared to the US at 5.4 deaths per 1,000. And currently, the leading cause of death in both of these countries is chronic diseases. When talking about the current challenges that both of these countries face in their healthcare system, oddly enough, even though one is a developed country and the other is a developing country, they both face similar issues. Geographic remoteness, specifically in catering to the communities in rural areas, is a challenge that both of these countries face. A big other issue that both of these countries face is massive healthcare disparities, specifically amongst low income families and racial and ethnic minorities. Also, even though there is universal healthcare provided to Filipinos, there are still a lot of high out of pocket costs and limited coverage specific when it comes to limited resources. While in the US, there really is not a limitation of resources, high out of pocket costs still tend to be an issue with healthcare utilization. Both countries have also seen an increase in chronic diseases, specifically in conditions like diabetes and cardiovascular disease. Both of these countries also have a shortage of physicians. In the Philippines, it tends to be seen due to low wages and geographic remoteness as well. While in the US, we mainly have seen a nursing shortage that has been actually filled by massive movements of nurses from other countries, specifically the Philippines. While there are many challenges that both countries' healthcare systems face to reach health equity amongst everybody, there have been seen recent changes and improvements in the hopes to reach health equity. In the Philippines specifically, even though the program of PhilHealth started in the 1990s that gave select people universal healthcare coverage, starting in actually 2019, the Universal Healthcare Act was signed that automatically gives all Filipinos access to universal healthcare that can be used in both the public and the private healthcare system. While there still is an issue with out of pocket costs, the country has also been increasing the amount of money that is allocated towards healthcare for the nation. And to better assist in the Philippines, there has also been an increase in preventative health measures and testing, specifically around diseases like HIV and tuberculosis, and community health worker programs to reach rural populations. In the United States, the Affordable Care Act was signed in 2010 that also created more opportunities and more access to people in the United States, specifically vulnerable populations like children and low to middle income families. Thank you for taking the time to listen to my presentation. I hope that you were able to get a bit of a better understanding of the Philippine healthcare system and the challenges that they face compared to the United States.